Magandang Miyerkules ng tanghali po sa ating mga kababayan at sa mga miyembro ng Malacanang Press Corps. Ngayong araw ay meron po tayong isang special presidential press briefing dahil nagpulong po kahapon ang Interagency Task Force at kailangan ipaalam sa ating mga kababayan ang ilan sa mga mahalagang resolusyon ng IATF. Aside from these, we will also be tackling some other updates, so I beg your indulgence as covering all these may take a little longer than usual. Una po rito ay inaprubahan ng IATF ang rekomendasyon na ipanatili sa Alert Level 2 ang lahat ng lugar sa Pilipinas mula bukas 16 ng Disyembre hanggang sa katapusan at 31 ng Disyembre. The entire country will continue under Alert Level 2 beginning tomorrow, December 16, until December 31, 2021. Kaugnay nito, inirepeal ng IATF ang guidelines on the implementation of community quarantine in the Philippines as amended at ang pag-adopt ng IATF sa guidelines on the nationwide implementation of the alert level systems for COVID-19 response as amended. Sa mga frontliners, kawani ng gobyerno, mga LGUs, volunteers, at sa ating mga kababayan, this would not have been possible without your cooperation, your help, and your sacrifices. Maraming salamat po sa inyong lahat. Let's keep this up. Huwag tayong bumitaw. Inaprubahan din ng IATF ang panibagong country risk classification effective December 16 hanggang December 31, 2021. Umpisan po natin sa red list. 8 po ang mga lugar na nasa red list. Ito ay ang mga sumusunod, ang Andorra, France, Monaco, Northern Mariana Islands, Reunion, San Marino, South Africa, at Switzerland. Ito naman po ang mga bansa o mga teritoryong nasa green list: Bangladesh, Benin, Bhutan, British Virgin Islands, Chad, People's Republic of China, Comoros, Ivory Coast, Democratic Republic of the Congo, Djibouti, Equatorial Guinea, Falkland Islands, Malvinas, the Gambia, Ghana, Guinea, Hong Kong, Indonesia, Japan, Kenya, Kosovo, Kuwait, Kyrgyzstan, Liberia, Montserrat, Morocco, Oman, Pakistan, Paraguay, Rwanda, Sabah without an H, this is the special municipality of the Kingdom of the Netherlands, Saint Bartholomew, Saint Pierre and Miquelon, Senegal, Sierra Leone, Saint Eustatius, Sudan, Taiwan, Timor-Leste, Togo, Uganda, at United Arab Emirates. 41 ang bilang ng mga lugar na nasa green list. Ang mga lugar na hindi ko binanggit ay nasa ilalim po ng yellow list. Kaugnay nito, nilift ng IATF ang pansamantalang suspension ng testing at quarantine protocols sa mga lugar na nasa green list. Ang susundin na testing at quarantine protocols ng mga international arriving passengers na galing sa green list ay ang latest testing at quarantine protocols na inaprubahan ng IATF. We will discuss these one by one. Una po sa lahat, ang mga bansang nauna nang napasailalim sa green list base sa case at test metrics. Kapag po mayroong local transmission ng Omicron, ay marere-classify po sila bilang yellow list. Ang green list ay iyong mga low-risk countries, territories at jurisdictions. Ito po ang mga protocol na mga galing sa green list na papasok sa bansang Pilipinas. Para sa mga fully vaccinated, kailangan nilang magpakita ng negatibong RT-PCR test taken within 72 hours prior to departure from country of origin. Kailangan din nilang mag-facility-based quarantine hanggang lumabas ang kanilang negatibong RT-PCR test taken on the 3rd day, after which they shall be required to undergo home quarantine until their 10th day, the date of arrival being the first day. Para naman sa mga unvaccinated, partially vaccinated, or individuals whose vaccination status cannot be independently validated na galing sa green list, kailangan nilang magpakita ng negatibong RT-PCR test taken within 72 hours prior to departure from country of origin. Kailangan din nilang mag-facility-based quarantine hanggang lumabas ang negatibong RT-PCR test taken on the 7th day, after which they shall be required to undergo home quarantine until the 14th day, with date of arrival being the first day. Lahat ng mga pasahero, Pilipino man o dayuhan na mag-transit mula sa non-green list country, jurisdiction or territory ay maituturing na hindi galing o nanggaling sa nasabing bansa o teritoryo kung sila ay namalagi lamang sa airport ng buong oras at hindi na clear na pumasok sa immigration authorities ng mga nasabing lugar. Titiyakin ng Department of Transportation na ang mga airline ay magsasakay lamang ng mga pasaherong susunod sa negative RT-PCR test before travel requirement. Exempted po dito ang mga batang may edad 3 taong gulang at pababa saan man bansa sila galing. Ang mga nasabing bata ay hindi kailangan magpakita ng negatibong RT-PCR test result bago mag-board unless symptomatic. Susundin ng mga minor na galing sa green list ang mga testing at quarantine protocols ng magulang or guardian na kasama nila sa biyahe regardless of the minor's vaccination status and country of origin. Pumunta naman po tayo sa yellow list o yung mga nasa moderate risk countries. Ito naman ang protocols ng mga pasaherong nasa yellow list na papasok sa Pilipinas. Para sa mga fully vaccinated, kailangan nila magkakuha ng negative RT-PCR test 72 hours bago sila umalis sa bansa kung saan sila galing. Pagdating ng Pilipinas, kailangan nila mag-facility-based quarantine at mag-RT-PCR test sa ika-5 araw, with date of arrival being the first day. Kahit mag-negatibo ang kanilang resulta sa RT-PCR test, kailangan nila mag-home quarantine until their 14th day from date of arrival. Para naman sa unvaccinated, partially vaccinated, or individuals whose vaccination status cannot be independently validated na galing sa yellow list, kailangan nila mag-RT-PCR test taken within 72 hours prior to departure from country of origin. Pagdating ng Pilipinas, kailangan din nila mag-facility-based quarantine at mag-RT-PCR test sa ika-7 araw, with the date of arrival being the first day. Kahit mag-negatibo ang kanilang resulta sa RT-PCR test, kailangan nila mag-home quarantine until the 14th day from date of arrival. Titiyakin na naman po ng Department of Transportation na mga airline ay magsasakay lamang ng mga pasaherong susunod sa negative RT-PCR test before travel requirement. Exempted po dito muli ang mga batang may edad 3 taong gulang at pababa saan mang bansa sila galing. Ang mga nasabing bata ay hindi kailangan magpakita ng negatibong RT-PCR test bago mag-board unless symptomatic. Susundin naman ng mga menor de edad na galing sa yellow list ang testing at quarantine protocols ng magulang or guardian na kasama nila sa biyahe regardless of the minor's vaccination status and country of origin. Pumunta naman po tayo sa red list o yung mga tinutukoy na high-risk countries, territories, and jurisdictions. Hindi po pinapayagan ang inbound international travel ng mga taong galing o nanggaling sa red list within 14 days prior to arrival to the Philippines anuman ang kanilang vaccination status. Tanging mga Pilipino lamang pabalik ng bansa via government or non-government initiated repatriation at mga nasa bayanihan flights ang pinapayagang makapasok, subject sa sumusunod na entry, testing at quarantine protocols. Para sa mga passengers na fully vaccinated, kailangan nilang magpakita ng negatibong RT-PCR test taken within 72 hours prior to departure from country of origin. Kailangan din nilang mag-facility-based quarantine at mag-RT-PCR test taken on the 7th day. Maaari lamang silang payagang ma-discharge sa facility matapos lumabas ang kanilang negatibong resulta ng kanilang RT-PCR test. Ngunit kailangan pa rin nilang mag-home quarantine until their 14th day with date of arrival being the first day. Again, para yun sa mga fully vaccinated. Para naman sa mga unvaccinated, partially vaccinated, or individuals whose vaccination status cannot be independently validated na galing sa red list, kailangan nilang magpakita ng negatibong RT-PCR test taken within 72 hours prior to departure from country of origin. Sasailalim din sila sa mandatory facility-based quarantine sa loob ng 10 araw with RT-PCR test taken on the 7th day, at maari lamang silang payagan ma-discharge sa facility matapos makumpleto ang kanilang 10-day facility-based quarantine. Kahit magnegatibo ang resulta ng kanilang RT-PCR test, kailangan pa rin po nilang mag-home quarantine until their 14th day with the date of arrival being the first day. Susundin muli ng mga minors na galing sa red list ang testing at quarantine protocols ng magulang o guardian kasama nila sa biyahe regardless of the minor's vaccination status and country of origin. Exempted po dito ang mga batang may edad 3 taong gulang at pababa saan man bansa sila galing. Ang mga nasabing bata ay hindi kailangan magpakita ng negatibong RT-PCR test result bago mag-board unless symptomatic. Hindi naman may tuturing na galing o nanggaling sa red list ang mga pasaherong nag-transit lamang sa red list na namalagi lamang sa airport ng buong oras at hindi na clear na pumasok ng immigration authorities ng mga nasabing lugar. Pagdating ng Pilipinas, ang mga pasaherong nag-transit sa red list ay susunod sa pinairal na testing at quarantine protocols. Dumako naman po tayo sa mga dokumentong kailangan ipakita para ma-validate ang vaccination status. Una, sa mga OFWs at kanilang mga asawa, anak at mga magulang na kasama nila sa biyahe, na nabakunahan abroad. Maaari nilang ipakita ang kanilang national, digital, or physical vaccination certificate ng foreign government kung saan sila nabakunahan nang hindi kinakailangan ng reciprocity agreement. Para naman sa mga Pilipino na hindi OFW na nabakunahan sa Pilipinas o sa abroad at mga dayuhan na nabakunahan sa Pilipinas, maari nilang ipresenta ang kanilang VaxCert-PH Digital Vaccination Certificate or yung Bureau of Quarantine World Health Organization issued International Vaccination or International Certificate of Vaccination or Prophylaxis or ICV ang tawag dito, or di kaya yung National or State Digital Certificate mula sa foreign government kung saan sila nabakunahan na tumanggap ng VaxCert-PH sa ilalim ng Reciprocity Agreement unless otherwise permitted ng IATF. Sa mga dayuhan na bakunahan abroad, kailangan ipakita nila ang WHO-issued ICV or yung National State Digital Certificate ng foreign government na tumanggap ng VaxCert-PH sa ilalim ng Reciprocity Agreement unless otherwise permitted by the IATF. Samantala, pinapaalala namin, pinagbabawal ang inbound travel ng mga batang walang kasama. Hindi pinapayagan makasakay ng eroplano ang lahat ng unaccompanied minor Filipino citizens galing sa red list, except if such minors are returning through the repatriation program of the national government or through a non-government initiated repatriation and bayanihan flights. Pagdating sa Pilipinas, ito turn over ang repatriated minors sa Overseas Workers Welfare Administration, house parent, who in coordination with the Department of Social Welfare and Development, DSWD, shall ensure the minor's safety and observance of quarantine protocols. Hindi naman pababalikin sa port of departure ang unaccompanied minor Filipino citizens na lumapag sa ating airport kahit na may pagbabawal. Sila ay ito turn over lamang sa authorized DSWD officer who can ensure their safety and observance of quarantine protocols. But this is without prejudice to penalties na ipapataw sa mga airline that allowed them to board, as provided in the applicable laws and rules, including those issued by the Department of Transportation and its attached agencies. Allow me to reiterate to all those who plan to come home during the holidays, we humbly request your patience as we in the IATF continue to make modifications to our protocols. These are all being done in response to evolving situations around the world. Ang punot dulo po nito is we want to keep our people safe, and we will do what is necessary to achieve that. Nagkaroon din ng desisyon ang IATF kung saan pinapayagan ang operasyon ng sabungan at traditional na sabong na nasa ilalim ng Alert Level 2. Kung walang pagtutol dito ang mga LGUs or lokal na pamahalaan kung saan gaganapin ang sabong. Ang pagpayag na ito ay subject sa mga sumusunod na protocols. Una, maximum of 50% venue capacity ng tanging mga fully vaccinated lamang. Pangalawa, kailangan fully vaccinated din po ang lahat ng on-site workers or employees. Pangatlo, cashless ang pagtaya o betting. Tanging technology-based platforms ang pinapayagan. Ibig sabihin nito, walang palitan ng pera sa sabungan at walang oral placing of bets. Hindi na pwedeng tumaya na nagsisigawan o nagsasalita. Pang-apat at panghuli, dapat mahigpit po ang local government units sa pagpapatupad ng minimum public health standards at technology-based betting. At dapat mahigpit ang pag-monitor nito ng Department of the Interior and local government. We enjoin LGUs that will allow the resumption of cockfighting operations to strictly enforce and implement these protocols and to shut down operators that fail to adhere to minimum health standards. Sa usaping bakuna, naitala kahapon ang pinakamalaking vaccine arrivals sa loob ng isang araw. Ayon sa National Task Force Against COVID-19, nasa 8 milyong doses ng COVID-19 vaccines ang natanggap ng Pilipinas. Kasama rito ang 1,512,000 doses ng Moderna na donasyon ng France at Spain. 2 million doses ng Sinovac na donasyon ng China. 1,778,400 doses ng Janssen na donasyon ng Sweden at Austria. At 945,600 doses ng Janssen na dumating ng Hapon at 2,011,200 doses ng Janssen na dumating kagabi na parehong donasyon ng the Netherlands. We extend our gratitude to the governments and the people of France, Spain, People's Republic of China, Sweden, Austria, and the Netherlands. Maraming salamat po sa inyo. Ulitin ko po, nandiyan na po ang bakuna sa mga di pa bakunado para po ma-enjoy talaga natin ang holiday season with our loved ones. Protect yourselves and your families by getting vaccinated. Now na. Pumunta naman tayo sa COVID-19 update. Patuloy na gumaganda ang COVID-19 situation sa bansa. Una, nasa 235 ang mga bagong kaso. Ayon sa December 14, 2021 COVID-19 Case Bulletin ng Department of Health. Ito na po ang pinakamababang naitalang bagong kaso sa taong 2021. Pangalawa, below 1% po. Nasa 0.9% ang positivity rate ng Pilipinas. Pangatlo, 97.9% naman ang porsyento ng gumaling. Nasa mahigit 2.7 million na po ang naka-recover. Pang-apat, nasa 1.77% naman po ang ating fatality rate at ito ay nananatiling mas mababa sa 2% global average. 10 ang naidagdag sa bilang ng mga pumanaw dahil sa coronavirus. At panglima, nasa below 25% naman ang ating hospital utilization rate. Sabi ng Department of Health, halos kalahati ng mga ospital sa buong Pilipinas ay walang inadmit na pasyenteng may COVID-19 mula December 5 to December 9. Narinig ninyo sa amin kahapon ang ginagawa nating paghahanda ng national government kaugnay ng Severe Tropical Storm Odette. As of 11 a.m. today, December 15, signal number 2 po ngayon ang eastern portion ng Surigao del Norte at Surigao del Sur. Naka-flash sa inyong screen ang mga lugar na under typhoon signal number 1. Ang mga residente na naninirahan sa mga lugar na natukoy na highly susceptible sa mga hazards ay pinapayuhan na sundin ang evacuation at iba pang instructions mula sa kanilang local officials. Para sa mga bumabiyahe, pinapaalala namin na nananatiling suspendido po ang land travel ng mga sasakyan papuntang Visayas at papuntang Mindanao. Epektibo noong December 13, 2020, 6 p.m. pa. Ito ay mananatiling suspendido hanggang malift ang tropical cyclone warning signal. Samantala, ang biyahe papuntang Catanduanes at Masbate ay suspendido rin. Ito'y epektibo December 14, 2021, 9 a.m. Ito'y mananatiling suspendido hanggang malift po ang tropical cyclone warning signal. The Civil Aviation Authority of the Philippines, CAAP, Operations Center is currently monitoring the typhoon movements and airport conditions. CAAP is also assessing possibility of suspending air traffic operations on areas expected to be affected by the typhoon. Samantala, bukas pa po ang ating mga pantalan pero ang mga biyahe sa mga Odette affected areas ay suspendido base sa Philippine Coast Guard advisory. On other matters naman po, our economic managers through the Development Budget Coordination Committee or DBCC have adjusted our growth target for 2021 to 5.5% from its previous forecast of 4 to 5%. This comes after our strong performance in the third quarter and the significant decline in the number of COVID-19 cases as a result of our accelerated vaccination drive. They say, and I quote, "As we continuously relax restrictions and increase mobility, economic performance is expected to accelerate further in the last quarter of the year." End of quote. Similarly, the Asian Development Bank, or ADB, raised its economic outlook for the Philippines in 2021 and 2022. According to the Asian Development Bank Outlook 2021, the Philippines is expected to grow by 5.1% in 2021 and 6% in 2022. The ADB says, and I quote, "Growth momentum has clearly picked up on the back of the government's vigorous drive to vaccinate Filipinos against the COVID-19 virus." End of quote. A number of economists from the private sector have likewise upgraded our economic growth outlook for 2021. You can see these on the screen. Kasama po dito ang Goldman Sachs Economics Research, ang S&P Global Ratings, Pantheon Macroeconomics, Fitch Solutions, Capital Economics Asia, at ang DBS Group Research. Dito po nagtatapos ang aking presentation. Makakasama natin ngayong hapon si Dr. Shirley Gigi Domingo, ang Vice President for Corporate Affairs at spokesperson ng PhilHealth, who will discuss some recent developments in PhilHealth. Dr. Gigi, go ahead.
Good afternoon po sa lahat. Good afternoon, Secretary Nograles. And una sa lahat, I thank you po for inviting me to this press briefing. No? I was informed that the issue here to be discussed and clarified by PhilHealth is the issue of the hospitals in Iloilo that has signified their intention to disengage with PhilHealth. So first of all, let me reassure our members or the population, since lahat po ng Filipino ay member na po ng PhilHealth under the Universal Health Care, that PhilHealth is on top of the situation by implementing strategies to fast-track funds to our hospitals. Kasi the issue here is delayed payments of PhilHealth reimbursements to these hospitals. And it's not all payments, all cases, but the COVID cases. So yun lang po ang ating issue with our hospitals. It's the COVID cases po. So let me reassure the public that PhilHealth is implementing reforms to fast-track or expedite the release of much-needed funds to our hospitals through a mechanism called the debit-credit payment method. Etong method po nito ay binibigay po natin yung cash equivalent to the amount of claims, good claims that are with us, minus of course the tax, to the hospitals while we are processing the claims that are with us. Secondly po, we are continuously reaching out to these hospitals through our regions and even through our national government, national office, head office, which is headed by our President, Attorney Dante Geran. We are implementing several reforms and continuously reaching out to these hospitals to avert any situation that will not be good for our members. No? Let me also dispel the notion that PhilHealth is not paying its claims, when actually we have paid since January 2020 to date. We have paid around 165 billion in claims reimbursements. As I said, let's isolate the issue. It is the delay in COVID claims. No? So aside from that, we have released also 11.04 billion through the DCPM method. And specifically to these hospitals in Iloilo, we have released 1.6 billion in claims reimbursement from January 2020 to date. Okay, now another issue that was brought up is the return to hospital claims. These are claims that were returned to hospitals because of deficiencies. Let me assure you that we do this because we are in keeping with our responsibility to safeguard the interests of our members and to protect the funds that are given to us. These are public funds kasi. Kaya dapat protektahan natin to. Kaya lahat po ng claims na pumapasok sa amin ay binubusisi po natin yon bago mag-release ng payment doon sa ating mga providers. Kaya kung may makita tayong deficiencies, ay kailangan po ibalik natin sa kanila para magkompleto nila yung deficiencies at ibalik po sa atin. So yun po, let me reassure also that we have enough funds to pay for the liabilities or to pay for the claims of our members that are coming into PhilHealth. As of June this year, we have 158 billion in reserve funds. Our cash flows are okay. No, we're able to, our cash is enough to pay our liabilities, which are the claims, and therefore the issue of money is not a problem. So may I reassure our members that we have enough cash to be able to pay for the benefit availment that when you go to hospitals and other providers during your medical needs. So lastly, may I say that we would like to call on our hospital providers that sana ay i-avail nyo po itong DCPM na ito. Marami pong challenges talaga dala nitong pandemic na ito ang pag-process ng claims dito sa PhilHealth. And therefore, na-conceptualize po natin ang DCPM na ito para mabigyan kayo ng funds na kailangan nyo po. Alam po natin na kailangan ng mga ospital ang mga funds ngayon, panlaban po dito sa pandemic dito. At yun po ang naisip natin, yung DCPM. Maraming ibang issues kayo na bring up sa amin tungkol sa DCPM, ina-address po natin yon. Katulad ng mga undertaking, ina-address na po natin yon. And lastly, I would like to tell our members that PhilHealth is committed to its mandate to make sure that when you avail of the services, ay meron pa kayong makaka-avail po kayo. Yan po yung ating mandate to provide you with your much needed benefits pag mangailangan po kayo. So yun po, salamat po.
Maraming salamat, Doc Gigi. Please stay on board for questions from our friends from the media. And with that, I would like to segue now to Yusek Rocky for the Q&A portion.
Yes, thank you, Secretary Nograles. Good afternoon din kay Doc Gigi. Ang una pong tanong mula kay Michael Flores ng AFP, when you say daw po the President plans to retire from government, that also means he's retiring from politics in general?
Well, the President is retiring from government after he ends his term sa June 30, 2022. As you know, he has withdrawn his candidacy for Senate, and he plans to retire from government after more than 4 decades of public service. What he will do after that, syempre as a retired government worker, siya po ay pabalik na sa kanyang private life and spend time with his family, become obviously a private citizen of the Republic of the Philippines with all the rights, enjoying all rights as a private citizen of the Republic of the Philippines.
Apo. Ang susunod pong tanong mula kay Evelyn Quiroz ng Filipino Mirror, can you give us a hint of the real reason why the President withdrew his Senate candidacy?
It's really to spend time with his family, no? After more than 4 decades ng serbisyo sa taong bayan, no? For more than 4 decades of public service, mula sa pagiging sa prosecution service as prosecutor, no? All the way up to being a mayor, vice mayor, a member of Congress, back to vice mayor, then now as President of the Republic of the Philippines. Now he wants to spend more time with his family.
Apo. From Joel Peleño of DWIC, South African researchers confirmed that based on their new details, the vaccines provide less protection against the Omicron variant. But they still see indication na mas milder pa rin ang symptoms ng Omicron compared to the previous na mga variant. Kung less ang protection ng mga vaccine against Omicron, paano na lamang ang mga unvaccinated? Maaring magiging severe ba ang effect ng variant na ito sa kanila or still mild pa rin?
With regard to severity ng Omicron variant, we are still currently collating the data. The WHO is currently collating all information at magbibigay sila ng update as regards yung severity ng Omicron variant, no? So wala pa talagang conclusive findings in terms of severity. Pero totoo po 'yon, no? Pag unvaccinated kayo, mas mataas obviously ang magiging banta, no? Sa inyong kalusugan at maging sa buhay ng mga unvaccinated. Kaya patuloy pa rin po ang pagsusulong natin ng vaccination dito sa ating bansa to fully protect our citizens, para fully protected po ang lahat ng Pilipino, lahat ng pamilya ng ating mga kababayan. Kaya napaka-importante po nito. And then, apart from vaccination, importante pa rin po yung minimum public health standards. So kahit bakunado po kayo, hindi naman ibig sabihin na fully protected ka na kung hindi mo susundin din ang minimum public health standards. So it's always mask, hugas, iwas, plus bakuna. Hindi po pwedeng hiwa-hiwalayin yan, hindi po pwedeng i-individualize yan. Kailangan all of that taken together para mas mataas po ang protection ninyo at ng inyong pamilya.
Thank you, Secretary.
Can we go now to Mela Lesmoras ng PTV?
Hi, good afternoon, Secretary Nograles, kay Dr. Domingo at kay Yusek Rocky. Secretary Nograles, unahin ko lamang po yung issue hinggil sa alert level system. Can you please elaborate bakit po nagpasya ang IATF na panatilihin yung alert level 2 given na sobrang baba na rin ng mga kaso ng COVID-19 sa bansa? At meron pa po ba kayong napag-usapan na ibang patakaran ngayong Pasko na paiiralin o ilalabas ang IATF?
Yung sa panahon ng Kapaskuhan, no? Nandyan pa rin naman po yung guidelines natin for alert level system. So, ang nangyari sa IATF kahapon sa aming meeting ay kasi pilot pa rin yung implementation dati ng alert level system, no? So, very clearly now, fino-forgo na po natin yung dating community quarantine system or classifications. Now we are fully implementing now yung alert level system sa buong Pilipinas. So titingnan natin ngayon ang ano yung mga do's and don'ts at guidelines mula sa alert level system. No? Alert level system 2 ang buong bansa. So dapat maliwanag para sa lahat ng mga LGUs, lahat ng mga provinces, cities, highly urbanized cities and independent component cities, hanggang sa barangay, maliwanag sa kanila ang mga do's and don'ts for alert level system 2. Pagdating sa Kapaskuhan, syempre, titingnan natin yung alert level system 2 at para ma-remind ang ating mga kababayan, meron pong mga reminders ang Department of Health at ang PCOO na nakikita po natin dito sa PTV at maging sa ibang mga kasamahan natin, ang kaibigan natin sa KBP ay tumutulong rin na ipalabas yung mga reminders na yan. Now, ang tanong, bakit alert level 2 pa at hindi pa tayo nag-alert level 1? Well, we are being very cautious because eto nga yung banta ng Omicron na nakikita natin sa ibang mga lugar, mga bansa, territories and jurisdictions na may positive na Omicron, lalo na local transmission ng Omicron, pataas ng pataas, no? Ang bilang ng COVID cases doon. At marami pa tayong hindi nalalaman tungkol sa Omicron. Plus, hindi pa namin talagang totally na-finalize ang mga parameters for alert level 1. Kung titingnan po natin yung guidelines for alert level 1, parang halos ma-open na ang lahat. But everybody will continue practicing minimum public health standards. So, hindi pa talaga tayo ganun ka-confident to open up places for alert level 1 because we need to still ramp up our vaccination. Kaya nga po meron tayong National Vaccination Days, number 1. Number 2, tandaan po natin, marami rin po tayong mga kababayan ang uwi dito sa ating bansa ngayong December. So we're being cautious at tama rin naman na dapat cautious muna tayo right now. Anyway, as we see it, yung economic numbers naman natin ay maganda. Yung employment numbers natin maganda din, gumaganda na rin. Yung hunger, poverty numbers natin, mababa na po. So with alert level 2, we're confident na nasa-secure natin ang health and safety ng ating mga kababayan but safely reopening our economy at marami na rin po ang nakakabalik ng trabaho. So because we want to keep it that way, ang desisyon ng IATF is hanggang December 31, alert level 2 po tayong lahat. pag-usapan namin muli ano mangyari for January 1 to 15.
Opo. At dito lamang Secretary Nograles naman sa naging pasya nga ng pag-withdraw ni Pangulong Duterte, may we know ano po kaya yung nag-trigger sa kanya para mag-decide na mag-withdraw na at paano naman ito makakaapekto sa kanyang quality of service sa kanyang nalalabing panahon sa termino?
Well, gaya ng na-release namin na statement, no? Unang-una, it's because the President wants to spend time with his family after more than 4 decades of public service. Number 2, dahil po hindi na siya kandidato for any position this coming elections, he can focus now on he can focus more on the COVID response. He can focus more on safely reopening our economy. He can focus more on continuing, if not even stepping up, more of the public service, lahat ng mga pagbabago, lahat ng mga magagandang mga programa na nasimulan niya, ay kaya na niyang mas lalo pa niyang masigurado na these are all put in place and implemented towards the end of his term as President. And more importantly, na makakonsentrate na rin din po siya unhampered on ensuring na we will have peaceful, transparent, and fair elections this coming May 2022.
Opo. At manghuli na lamang, Secretary Nograles, kailan po kaya mag-aanunsyo si Pangulong Duterte kung sino na yung bago niyang i-endorsong kandidato? Or baka meron na po ba kayang bagong i-endorso na kandidato?
Abangan na lang po natin sa tamang oras at panahon ay magsasalita si President Duterte tungkol po dyan.
Okay. Maraming salamat po, Secretary Nograles, Dr. Domingo at Yusek Rocky.
Thank you, Mela. Let's go back to Yusek Rocky for other questions from...
Yes. Thank you, Sec. Karlo. Ang susunod pong tanong mula po kay Red Mendoza ng Manila Times para po kay Doc Gigi Domingo. Ano na ang mga paraan ng PhilHealth para hindi madagdagan ang mga hospital na may balak ng kumawala sa ahensya dahil daw po sa mga hindi nabayarang mga pagkakautang na ito? Doc DG?
Ay, Doc, naka-mute yata po.
Oo, sorry. Una sa lahat, gusto ko po sabihin sa inyo, wala po tayong natatanggap na official notice from hospitals that they will disengage by next year. We heard that the 7 hospitals, through their announcement, will plan to disengage. But wala pa tayong natatanggap na official notice po. Now, ano po ginagawa natin? As I said, yung issue po natin dito ay delayed in COVID claims. No? Kaya magre-release po tayo ng third wave of DCPM. The third wave of DCPM will be offered nationwide na po as long as the hospitals are managing a COVID claim. As long as they're managing COVID cases po, they are included in the qualified hospitals to avail of the DCPM-3. And dati po 60% binibigay natin, ngayon ay 80% of the amount computed na po ang binibigay natin para ma-expedite lang ang funds na ito sa mga hospital.
Opo. Doc Gigi again and kay Secretary Karlo na rin po, mula pa rin po kay Red Mendoza ng Manila Times, kinwestiyon po ng COA ang sinasabing IRM payments na may halagang 15 billion pesos dahil daw di umano ay wala raw itong legal basis ayon po sa PD 1445 o ang Government Auditing Code kung saan bawal daw ang advance na pagbabayad sa mga serbisyo o material na bagay na walang approval mula sa Pangulo. Ano po ang reaksyon ng PhilHealth dito at may reaksyon din po ba daw ang palasyo dito?
Unahin muna natin si Doc Gigi.
Salamat po. Salamat po also for the question po. PhilHealth maintains that we have legal basis to implement the IRM. May provision po tayo doon sa RA 7875 as amended that PhilHealth can implement provider mechanisms such as global budget and other payment mechanisms that we see fit will benefit the members. Global budget po, ito ay isang kabuuan na payment based on some criteria, and it is a prepayment po, katulad ng IRM. Secondly, sa Universal Healthcare Law ay meron po nakasulat rin doon that we should shift to prospective payments. No? Prospective, yung hindi pa nagagawa yung serbisyo, binabayaran na natin sila. Pero yan nga, katulad ng global budget nga. So nandun rin po yon sa Universal Healthcare Law. So para sa atin po, ay yun po yung binibigay natin as legal basis to implement the IRM.
Okay. Thank you, Yusek Rocky.
Opo. Susunod po.
Can I just add, no? But in relation to that, Ren, we also requested a post facto approval from the President from Malacanang para dito sa IRM na ito. Thank you.
Opo. Thank you, Doc Gigi. Susunod pong tanong, Secretary Karlo, si Joe Montemayor ng Malaya, pero natanong na po ni Meriles Moraes yung kanyang unang tanong. Yung second question niya, with the recent developments, are there concerns that some PDP members might leave and transfer to other parties?
Yung PDP Laban will continue to support President Rodrigo Duterte in this decision and in whatever decisions that he will have in terms of his governance, in terms of public service, all the way up to the end of his term as president. PDP Laban will continue to stand by the president. And PDP Laban will also continue to be the dominant political party based on law and jurisprudence. It will continue to be the dominant political party for the 2022 national and local elections.
Opo. May pahabol lang po tanong si Samuel Danilla ng Business Mirror, Secretary Karlo. May projection po ba ang economic managers kung ano ang magiging impact sa economy in case po ma-declare na ng Alert Level 1 ang some parts ng bansa?
Wala pang nare-report sa amin sa IATF in terms of ano yung projections niya. Yung current projections ng DBCC is based obviously on what is happening on the ground presently, no? Wherein alert level 2 tayong lahat. But until siguro January, then perhaps dun pa siguro mafa-factor in if ano yung maging effect nun or full effect ng alert level 1. But as we see it, under alert level 2, maganda naman ang lahat ng nakikita nating economic numbers, pati ang mga projections, and not only in the Philippines but even internationally, no? As stated or as we already reported, ay marami na po mga top economic forecasters have already given plus projected forecasts for the Philippines at the end of 2021. And we hope na tuloy-tuloy nito up to 2022 as forecasted by many economic experts. Thank you.
Last question lang po mula kay Jopel Peleño ng...
Go ahead, Yusek Rocky.
Opo. May dalawa lang pong tanong na pahabol si Jopel Peleño ng DWIC. Natanggap na po ba ng Palace yung copy ng ratified bill from Congress regarding po sa 2022 proposed national budget at kailan po kaya ito malalagdaan ng Pangulo para daw po maging ganap na isang batas?
Opo, as na-monitor po namin na nagkapirmahan na po, no, ng mga miyembro ng Bicameral Conference Committee, nilagdaan na po nila. Pagkatapos po niyan ay it has to be brought back to their respective houses for its ratification in the House of Representatives and in the Senate. Then pagkatapos po niyan ay ipapadala nila sa Malacanang. So as of the moment, hindi pa namin tatanggap, but we will continue to monitor it. Kung kailan lalagdaan ni Pangulong Duterte, syempre meron po yung proseso. Dadaan po yan sa proseso, pero sa lalong madaling panahon dahil napaka-importante pong ma-approve natin ang 2022 national budget.
Thank you, Secretary Carlo.
Thank you, Yusek Rocky. Let's go to Maricel Halili ng TV5.
Hi, sir. Magandang hapon po, Doc and Yusek. Good afternoon. Sir, you mentioned earlier that President Duterte wants to spend more time with his family and to focus on COVID response. If that's the case, why did he file COC in the first place? I mean, does it confuse the public considering that not only him, but also other politicians or other aspirants change their minds often?
Siyempre, marami sa ating mga kababayan, mga kapartido ni Pangulong Duterte at maging sa ibang partido ay nagkumbinsi sa kanya na dapat ay pagpatuloy niya ang kanyang serbisyo. Kaya siyempre maraming iniisip si Pangulo kung saan ba siya tatakbo. So maraming mga suggestions, mga recommendations, maraming tumutulak talaga sa kanya na wag mo na mag-retire, na tumakbo siya, no? At magpatuloy sa kanyang public service, no? Despite the fact na, again, as I said, more than 40 years na, 4 decades na po siyang naninilbihan sa publiko. But as with filing, as with running for any position, it all boils down to a personal decision talaga ng isang tao, ng isang kandidato. At the end of the day, after giving it much thought, the President decided na mag-retire na lang from government, no? And concentrate on the family, no? So even after he filed, di ba, marami rin mga kandidato, mga political parties are already endorsing him for Senate. So marami talaga, nandun talaga yung pressure na gusto nilang magpatuloy si Pangulong Duterte. But at the end of the day, it's always a personal choice for anyone who runs or files candidacy in whatever position. So at the end, naging personal decision din ni Pangulo na at the end of the day, he wants to spend more time with his family.
But sir, yesterday, just hours before President Duterte filed his statement of withdrawal, his daughter, Mayor Sara Duterte, who's also running for Vice President, endorsed him for Senator. Ano pong nangyari? Hindi po ba na-inform si Mayor Sara that her father will be withdrawing from the presidential race? Nag-uusap po ba sila?
I think ang titingnan na lang natin dyan yung huling statement ni Mayor Sara after the President withdrew his candidacy for Senator. At ang sabi po ni Mayor Sara is she will support the President's decision.
But how is their relationship, sir? Are they in talking terms?
They're in talking terms. The relationship is father and daughter. As with fathers and daughters, they will always love each other. As a father loves a daughter and as a daughter loves a father.
Sir, kanina meron pong nilabas na pahayag si former Senator Bongbong Marcos. He said that the withdrawal of Senator Bongo from the presidential race reinforces this current signals the consolation of administration forces to BBM Sara unit team. Meron po bang ibinigay na dahilan ng administration for former Senator Marcos to think like this?
Well, as far as PDP Laban is concerned, nag-issue po ng statement ang PDP Laban that they will stand behind the President in whatever decisions he has in terms of public service at hanggang sa dulo ng kanyang term. The President has given his reasons for withdrawing. So hanggang dun lang.
Sir, panghuli na lang po, how will the decision of the President and the decision of Senator Bongo affect the candidacy of the members of PDP Laban, especially those who are included in the senatorial slate? Well, considering na supposedly ruling party ang PDP Laban.
Well, PDP Laban will continue to be a force to be reckoned with because PDP Laban will continue to be the dominant political party for the 2022 national and local elections as provided by law. Siya pa rin po ang dominant political party.
But sir, doesn't it show the weakness on the side of PDP Laban considering that, well, two of the highest officials of PDP just withdrew?
Well, titingnan na lang natin no, yung composition ng PDP laban. Even in the local level, province, city, municipality level, even district level, no? Marami, karamihan ng mga miyembro ng PDP at nag-file under PDP are incumbents, are second termers, third termers, comebackers even. So mabibigat na mga public officials ang tumatakbo under PDP laban. Kaya PDP laban will continue to play a big part as the dominant political party for 2022 national local elections.
Okay, marami pong salamat, Secretary.
Thank you. Let's go to Trisha Terada of CNN Philippines.
Hi, good afternoon, Sec Karlo, and to Dr. Shirley. Sir, first question for you na lang from my colleague George Cahiles. Yung concern lang po kasi for OFWs, we've been trying to reach out to OWA, but we're not getting a response as of the moment. So I think the question was for IATF. Ano po ba yung solutions na tinitignan natin when it comes to the lack of quarantine facilities for OFWs? Because we've been seeing pictures, sir, that they're really in dire need of help. May mga cases na nawawalan ng tubig, and yun nga po yung sa iba, kulang daw po talaga yung facilities for arriving OFWs.
Yes, that's the reason why binalik natin yung green list, no? So for the green list countries, upon consultation with our health experts, mataas naman ang kumpiyansa na ibabalik natin dun sa dating green list protocols. So for green list countries, mas mababa na po yung number of days for quarantine because yung testing niya for fully vaccinated, di ba, nasa third day na. So ganun, dinivide na nun. Before it was only yellow list protocols, now we've divided it into back to green, yellow, and red. That will release some pressure in terms of the number of days of quarantine, although importante pa rin yung home quarantine. So i-endorse namin sa LGU to make sure, ang LGUs will make sure na they really follow the home quarantine protocols, no? But that will medyo loosen up a bit, no? Dun sa mga facility-based quarantines na kinakailangan. Number one. Number two, yung constant coordination with the Department of Transportation, pati yung mga airlines, to make sure na maganda yung spacing din nung pagdatingan ng mga flights from abroad. No? Then number three, yung coordination also with our bayanihan flights, government and non-government repatriation flights. So it's really a lot of coordination that has to happen on the ground between and among different agencies. Pero malaking bagay na yung binalik natin yung green list protocols.
So, sir, bali yung pagbabalik po ng green list protocols, yun na po yung response ng IATF sa proposal po ng OWA to shorten the quarantine period of arriving OFWs. Tama po ba?
Yes, it will relieve a lot of the concerns in the ground because retaining the yellow list protocols for all except red, magkakaroon na ng higher capacities, no, ang facility kasi mas mabilis na yung magiging turnover ng incoming and outgoing sa mga facilities without sacrificing yung health and safety ng lahat.
Pero sir, paano po planong tugunan ng IATF yung parang hindi pa rin po na-address na concern, or kumbaga may mga cases pa rin po na yung facility na tinutuluyan ng mga OFWs natin are, I would say, in poor condition. Like halimbawa may mga facilities daw po na kinukulang ng tubig and sobrang liit lang po talaga for them to even move around.
Well, these are operational issues that OWA has given us, pati yung the different agencies also has given the assurance that they will address these issues. No? May mga pangilan-ilan po yan. These are operational issues that OWA has assured the IATF. And with the help and assistance of the concerned agencies, i-address po yung mga ganyan mga particular issues. This is not common to all. These are just particular issues for particular facilities, pero may assurance po na ayusin po lahat.
Alright, thank you very much, spokesperson. Sir, can I just please go to Dr. Shirley? Very quick lang,
Go
one
ahead.
question now.
Go ahead. Doc Gigi, go ahead with your question.
Hi, Doc. Good afternoon. For perspective lang po, bakit po natatagalan yung COVID-related claims, and how and why is it taking time for PhilHealth to adjust po? Kahit po almost 2 years na po tayo into the pandemic to, kumbaga, thresh out or to figure out how we can really speed up the process for claims po.
Okay, thank you for that question. No? First of all, kaya nadidelay yung COVID claims because of some policy issues. Policy meaning, for example, there was some issue about paying confirmed and probable cases. Our policy was to pay for confirmed and probable, which was the issue earlier in the pandemic, di ba? There were some probable, but if you have these certain conditions, it is considered a case pa rin. Nagka-issues to. As we all know, meron ibang nakasuhan from PhilHealth for paying na dapat hindi nabayaran because hindi naman COVID case, no? Because there was no positive RT-PCR. So these are policy issues that we had to settle. And there were also some issues that's above PhilHealth, katulad ng payment ng remdesivir and other medicines which were not in the PNDF. So the issues were, should we pay for this? Wala sa PNDF, that's against the law actually for PhilHealth, which as government agency, we should not pay any claim or medicines that are not in the PNDF. So there were several others policy issues. No? And inisa-isa po natin yun. Sabihin ko sa inyo, tinutukan po talaga yan ni President Attorney Geran po at inupuan ng Execom at iniisa-isa po namin lahat ng policy issues na to para mapabilis yung claims. Secondly, talaga naman naapektuhan, just like any other organization, ang PhilHealth dito sa pandemic. Yung human resource natin, our claims went up from around 30,000 maybe 4 years back a day. Ngayon ay 39,000 a day ang tinatanggap nating claims. So talagang tumaas without the equivalent increase in human resource, plus maraming na-isolate, na-quarantine, nagkasakit. We had, unfortunately, some people who passed away because of COVID-10. Some people, we had to follow IATF guidelines of 30% only in the office or 50% in the office. Of course, we let them work at home, pero iba po yung condition. Wi-Fi was slow and all that. Ganun po yun. There were so many challenges po ng pandemic. But as we said, we tried to implement lots of reforms, like katulad na in-augment natin ang human resource doon sa ating mga claims processing units. We streamlined processes, no? Yung claims processing, ini-streamline po natin yun from several steps, mga 20 steps, binawasan na po natin yan, mga 10 steps na lang. Ganun po yun, marami po tayong ginagawa. May challenges, but we have tried to overcome these challenges.
But do we have a commitment to hospitals? Like, for example, is there any specific deadline from the end of PhilHealth kung kaya halimbawa po kapag nag-claim sila, nag-file sila for reimbursement or claim, mabibigay po agad yung kailangan nila for a certain time frame?
Well, under the law, we are allowed 60 days to process claims po. No? Kaya nga we are implementing itong DCPM3 nationwide. And yung inclusion po nito, lahat po ng claims starting January 2020 up to August 21, 2021, for claims that are more than 60 days with us, ay babayaran na po natin yon through the DCPM3. And na-mention ko earlier, DCPM 1 and 2, we paid only 60% of the amount while we are processing. Para kung may RTH denied, ay ma-charge dun sa 40%. But this time, 80% na po ang i-release natin kaagad sa mga hospitals while we are processing claims.
All right. Thank you very much, Dr. Shirley. Thank you also to Karlo Nograles and to Yusek Rocky.
Salamat din po.
Thank you, Trisha. Let's go back to Yusek Rocky if you have other questions. Meron pa ba?
Secretary Nograles, wala na po mga tanong sa mga kasama natin sa media.
Thank you, Yusek Rocky. Advance Merry Christmas sa iyo at sa buong team.
Thank you.
At maraming
Thank you,
salamat.
Secretary.
Maraming salamat din po kay Dr. Gigi Domingo of PhilHealth. And Merry Christmas din po sa inyo.
Thank you po at Merry Christmas na rin po sa inyo. God bless po.
Sa mga residente ng mga lugar na dadaanan ng bagyo, maging laging handa at maging ligtas. Huwag pong maniwala sa fake news o sa mga naririnig sa tabi-tabi. Please get weather advisory and bulletin updates from official government websites and official news channels. Samantala, bukas, December 16, ay simula na ang simbang gabi. Ituloy po natin i-observe ang minimum public health standards. Mag-mask po, hugas, iwas pa rin po tayo, lalo na nandyan pa rin yung banta ng Omicron variant. Sa mga hindi pa po bakunado, mas mainam po na mag-attend na lang po ng online or virtual simbang gabi. Mas mainam po magpabakuna na po tayo. Ingat po lahat. God bless. At Merry Christmas in advance.